And the cost of living crisis has come to dominate the thinking of both the National and the Labour parties in terms of their launches and in terms of their policy responses to the issues of the day. Although education, health, I guess, law and order, environmental concerns are still there and being addressed by political parties of the day, the truth of the matter is that most of us, when it comes to this coming election, will have foremost in our brains the cost of food, the cost of fruit and vegetables, the mortgages, the rents that we're paying, and of the economic conditions in which we find ourselves, with no respite being offered in the very near future at all. And so how politicians and political parties deal with that is obviously framing that debate. Well, add to that then that Chris Hipkins, the leader of the Labour Party, in a quite interesting announcement, has declared that Labour, if re-elected, will introduce a free 18 to 30-year-old dental service in this country, which will deal with the basics of dental care, which he argues is largely unaffordable to that age group, but he acknowledges has significant issues of affordability anyhow. To join us to talk about that and that general criticism of affordability, we're joined by the president of the New Zealand Dental Association, Amanda Johnston. Amanda, thank you very much for joining us this morning. Welcome to the show.
Kia ora, good morning.
Where are you based, in Wellington?
Whangarei.
Oh, okay, so you're a practicing dentist yourself?
Yes, I'm a general practitioner in Plunket.
Tell me, how many dentists are there in New Zealand, roughly?
There's roughly 2,800 practicing dentists across the public and private sector, including specialists. Okay,
there are 2,800 of you. If tomorrow 18 to 30-year-olds suddenly got free dental care, as is the promise of the Prime Minister, could you cope?
Not straight away, no. It would need to be phased in over a little bit of time. No, not straight away.
Why couldn't you cope? Is it because most of your existing practices are fully subscribed?
Certainly, it's fairly stretched in the workforce, especially in rural and provincial areas. So I think in the main centres there's probably a little bit better availability. And the other thing is to remember that quite a big number of that population between 18 and 30 are already receiving dental treatment. So some of those patients are already being seen across the country. So whatever the increase would be would mean more work for those who are practicing. But it would take some time to get those numbers lined up.
So the Prime Minister also seemed to announce that he recognised that there was a workforce issue, and that is why he was going to increase the number of training positions at Otago University's dental school. Is that the only place in New Zealand that trains dentists?
Yes. There are oral health therapists trained in Otago and in Auckland AUT, but the only dental school in New Zealand is in Dunedin.
And the kind of work that the Prime Minister outlined over the week, that would need to be done by dentists, dental therapists couldn't do it?
At the moment, there is the possibility of advancing scope for oral health therapists into more simple tasks on adult patients. So that's a possibility to look into. At the moment, they're just really looking at the Labour Party policy is looking at extension of the contract which we currently have to treat up to age 18. So that does include a bit more complex treatment like possibly extractions and root canal treatment, which isn't in the scope of oral health therapists.
Right, because that was the next question I was going to ask. How much of a dental problem do 18 and 13-year-olds currently have in this country? In other words, is there a critical need?
Certainly, the hospital admission statistics for dental emergencies has the highest proportion in that age group. So that 18 to 30-year-old bracket has the highest proportion of dental emergencies admitted to hospital. And we suspect that there's quite a significant jump in the need for acute dental treatment after the age of 18 because it's not provided for free. So I think this is a sector of the community where, they might be tertiary students, they might be apprentices, they might be young parents, there's school leavers that are probably at the lower end of the income bracket, and so they don't prioritise dentistry in their budgeting.
When you say acute, Amanda, my little antenna goes off because I'd go, yes, but I could have got that injury in a rugby game, a league game, in a fight on a Friday or Saturday night. Do you make a distinction between the acute admissions that are caused by accident injury that I've just described and by deterioration that you just simply haven't been looking after your teeth?
Certainly. So if you have an accident at rugby, you're covered to receive treatment under ACC.
Right.
So that's a totally different section. You can be seen in private practice with a minimal co-payment, and ACC covers your treatment then. So obviously, that's the highest proportion of the population having rugby or sports injuries, accidents, car accidents, those sort of things. That's treated under ACC. So that's not the same as hospital admissions for acute dental disease, which is a different thing.
Did you have any prior knowledge that this policy was to be announced before Saturday?
No, not really that this policy was going to be announced, but we have talked to all the political parties about trying to increase accessibility for oral health services across the country. So we've been campaigning quite hard to lift the profile of oral health to make it a bit more of a priority and bring it in line with general health, really. It just seems unfair that it's just received no funding or subsidies at all. And so I think that age group, the 18 to 30s, is certainly one that we would consider to be a target area requiring some assistance financially, simply because the hospital admissions that cause some dental disease in that age group are largely preventable. If they'd had simple treatment earlier on, then you wouldn't need really expensive emergency hospital treatment.